Bad taste in the mouth is very common. People describe it in different ways. Some say it feels metallic, others describe it bitter, sour, chemical, or simply unpleasant. Very often, no one else notices anything. There is no bad breath, no external smell. The first and most common cause of bad taste in the mouth is bitter taste due to postnasal drip. Postnasal drip is when mucus continuously flows from the nose and sinus into throat, especially during sleep. At night, swallowing is reduced, and the components of mucus, inflammatory proteins, enzymes, and bacterial byproducts clog the throat and tongue. This creates bitter and foul taste in the mouth. In this situation, the bitter is strongest immediately after waking. Many people need to clear the throat, cough up mucus, feel a lump-like sensation in the throat. The taste usually improves after drinking water or brushing teeth and eating breakfast. Postnasal drip can be triggered by common cold or viral infections, allergic rhinitis, and dry air. After a common cold, the taste may last several days, while allergy-related symptoms can persist for weeks to months. The second most common cause is silent acid reflux, even without heartburn. In this condition, acid and digestive enzymes reflux up to the throat, especially in the morning. People often notice morning bitterness, soreness, and hoarseness, and raspy voice on waking, and it's chronic condition, chronic throat clearing. Symptoms are typically worse after meals. To treat this bitter taste in the morning, the simplest and most effective step is warm water immediately after waking. It helps wash away overnight mucus and improves saliva flow. If a person has sinus problems and sinusitis, and nasal saline rinse in the evening is very helpful. It reduces mucus buildup before sleep and limits postnasal drip overnight. Using humidifier at night also helps significantly. Keep room humidity around 50%. It prevents nasal dryness, thins mucus, and improves drainage. Sleeping with head elevated is important because gravity reduces mucus pooling in the throat. This can be done simply with extra pillow or slightly mattress elevation. A warm shower before bed can help as well. Steam hydrates the nasal lining and improves sinus drainage, which reduces morning bitterness. Also, no food for at least 3 hours before sleep. This is especially helpful if a person has acid reflux. Sleeping on the left side also matters. Anatomically, this position reduces reflux because it keeps stomach content lower relatively to the esophagus and the throat. In the evening, it's important to avoid trigger foods like chocolate, fatty foods, alcohol, mint, and late coffee. Chewing sugar-free gum after dinner can help as well. It increases saliva production, which helps neutralize acid and clear residual reflux from the throat. Another common cause of bad taste in the mouth is dry mouth. It is a very frequent reason. Even mild reduction in saliva dramatically increases bitter taste perception. Saliva normally dilutes and clears, and when it is reduced, bitterness becomes much more noticeable. This is common in people who breathe through the mouth, and in those with sleep apnea, and in people taking certain medications, especially antidepressants, antihistamines, blood pressure medications, and sleep medications. It is very common also in older adults. Another and one of the most common cause of bad metallic taste is common cold and other respiratory tract infections, for example, COVID-19 or flu. It's the most common and most frequent short-term cause of bad taste. This is very common in people recovering from a cold or flu, and in children and adults during autumn and winter. In the people with recurrent viral infections, typically the taste is bitter in the morning, mucus feels thick in the throat, there's frequent throat clearing, a runny nose or blocked nose, and usually it improves after drinking water or eating breakfast. Another common cause is gum disease. It accounts around 30% of chronic bitter or metallic taste complaints, and it's one of the most underestimated cause. It is common in people with bleeding gums or poor flossing habits, smokers, people with diabetes, and older adults. The taste is usually described as metallic or bitter. This happens because microbleedings from the inflamed gums release blood, which has a metallic taste. In this case, management is daily brushing twice, regular flossing, saltwater rinses, professional dental cleaning, smoking cessation, and when appropriate, antimicrobial mouthwash. The fifth most common cause of bitter taste is oral yeast infection. It is called oral candidiasis. It is common after antibiotic use in people using inhaled corticosteroids, people with diabetes and immunocompromised patients. The taste is usually unpleasant and persistent. It accompanied by burning sensation. It is important of the tongue, dry mouth, white patches on the tongue and inner cheeks. Taste does not fully improve after drinking water. Is often described as bitter or chemical-like. A mechanism is yeast overgrowth. And what can be done? Rinse the mouth after using inhaled corticosteroids is important. Reduce sugar intake and maintain excellent oral hygiene. Yogurt and probiotics also help. And antifungal treatment is required sometimes. Another common cause of bad taste in the mouth is medications. It is one of the leading contributors to persistent metallic or bitter taste. Hundreds of commonly used prescribed drugs can cause these side effects. This includes antibiotics, antidepressants, blood pressure medications, antihistamines, thyroid medications, and some vitamins and supplements. The taste usually is described as metallic, bitter, or chemical. It is usually begins after several days starting a new medication or changing the dose. Another common cause and commonly ignored one is dehydration. Even mild dehydration can dramatically worsen taste perception. Many people wake up slightly dehydrated, especially if they drink coffee or alcohol the day before, or sweat at night, or simply don't drink enough fluids. In this case, the taste is usually bitter or metallic, and strongest in the morning and improves quickly after drinking water. Another common cause is recent viral infection. Even without runny nose, many people think that taste changes only with severe illness. It's not true, but even mild viral infection can temporarily alter taste. This is especially common after common cold or flu-like illnesses. The taste is often bitter, sometimes foul, and worse in the morning. People may notice throat irritation, mild congestion, frequent throat clearing, but sometimes the only symptom is altered taste. It happens because virus causes inflammation of the nasal and throat lining and increased mucus production. This mucus is rich in inflammatory mediators and directly affects taste receptors. The good news is that it's self-limiting. In most cases, disturbance resolves within 1 or 2 weeks and inflammation subsides. And another common cause is stress and anxiety. This is not psychological imagination, but stress has a real, measurable effect on saliva production and sensory perception. During chronic stress, sympathetic nervous system suppresses saliva secretion. So it causes dry mouth and it alters taste receptor action. And another common cause is ketosis or prolonged fasting. When the body shifts toward metabolism, ketone bodies are produced. Some of these compounds are excreted through breath and saliva, and a person can have chemical, metallic, or slightly sweet, bitter taste. It is common in people who are on low carbohydrate diets, intermittent fasting, or during rapid weight loss. And finally, another very common and often missed cause is tongue coating. During sleep, especially with dry mouth and mouth breathing, a thin layer of debris, bacteria, and dead cells accumulates on the tongue, and this coating traps bitter compounds and alters taste perception. There is no pain, no infection, and no serious disease, just mechanical buildup. This cause this is extremely common, especially in people with dry mouth, reflux, and post-nasal drip.